Yang tu kita panggil external autoinfections. Another one adalah internal autoinfections. So kalau internal autoinfections ni is through reverse peritosis, in which the egg produced by the adult Tinasolium ni dia retrograde, dia go back into the duodenum, and then dia hatch, and it can cause Cysticercosis. Dapat ya? So kalau kita ingest eggs, memang dia the cycle tu dia akan jadi sama macam dalam pigs lah. So dia akan cross, dia akan penetrate the intestinal wall, so dia akan pergi kepada various tissues or organs and form the cysticercus or cysticerci. Okay, then patient develop cysticercosis. Faham dapat tak? Faham ada beza intestinal dengan cysticercosis, intestinal tenuosis dengan cysticercosis. So kalau that human, kalau that person, kalau dia just eating raw or undercooked pork meats, so dia tak semestinya dia dapat cysticercosis lah, unless dia ingest the eggs. Dapat tak? Okay. Siap sikit. Masa kita okay, so the pathology, okay, so intestinal tenuosis and tissue cysticercosis, actually they are two distinct clinical entities. So ni yang I mention tadi lah. So because the intestinal tenuosis, okay, it caused by adult worms, and then the cysticercosis is caused by larva of Tinasolium respectively. So in symptomatic intestinal tenuosis, patient might present with weak abdominal discomforts, indigestion, nausea, diarrhea, and also weight loss. And then occasionally orally they can have complications like intestinal obstructions ataupun acute appendicitis. So whereas cysticercosis ni dia actually dia potentially fatal lah, dia boleh menyebabkan kematian, and dia punya manifestation varies depending where the involved organs. So let's say in the brains, so the manifestation will be brain punya symptoms lah. So patient can have seizures, unconscious, headache. Okay. So kalau in term of immune response, okay, so larva tadi kalau dia boleh evoke the cellular reactions or inflammations lah, where bodies will produce lots of inflammatory cells, neutrophils, lymphocytes, eosinophils, and plasma cells, and then followed by formation of fibrosis, and then death of larva. So kalau dalam X-ray kita boleh nampak calcifications kalau larva tu dah mati, dan ada fibrosis and also death of larva. Okay, so yang ni you boleh nampak X-rays ni, multiple calcified cysticerci in the muscles. Kami nampak ni dia punya cysticerci ni dah mati lah, so dia nampak calcified cysticerci in the muscle. Okay, so ocular and periocular cysticercosis ni dia tak common. So cysticercosis in mata, ocular or periocular ni is only occurs about 20% of cases, and then the condition can lead to iritis, uveitis, and also conjunctivitis. And in some patients they might present with blurred or loss of visions. Neurocysticercosis. Okay, so this is the most common, by far the most serious clinical manifestation. And the symptoms usually appear several years after infections when death of the cysticercosis causes marked inflammatory reactions. Okay, so the clinical symptoms, patients can have seizures or fainting or epilepsy, symptoms of increased intracranial pressure, inflammations of the brain tissue, encephalitis, or inflammations of the meninges, and also patient might have psychiatric symptoms, and also problems involved in the spinal cords and also its membranes. So diagnosis for intestinal stenosis, you dah belajar dah. Diagnosis is through, you tengok apa? Microscope kan? Microscopic examination. So you tengok for demonstrations of the eggs or gravid proglottids in the feces. That's for intestinal stenosis. Tapi you tahu tadi, you mentioned before, so you tengok you cannot differentiate between these two species lah, dia punya eggs. So another things you can do is do imaging. Okay, imaging you can do X-ray, CT scan, MRI, so sama macam Hadathi tadi. You can do imaging, and also you can do serodiagnosis. So serodiagnosis, you can do ELISA to look for antibodies. You boleh juga buat tengok CSF through. So CSF you must buat lumbar puncture lah. So you ambil CSF and tengok for eosinophils, the percentage of eosinophils, and also you can do peripheral blood and look for eosinophils as well. So for the treatment, we can give antihistamine drugs, praziquantel and niclosamide, which is effective for intestinal stenosis. Whereas for neurocysticercosis and also ocular lesions, if there is no contraindications and if the lesions are isolated, we can do the surgery. And also we giving the drugs, antihistamine drugs prior to the surgery. Okay, that's all for cysticercosis. Ada masalah lagi tak? To avoid eating raw or undercooked pork. So inspection for cysticercosis, improvement of general sanitation, and also treat the infected patients. So for cysticercosis ni, avoid foods contaminated with eggs of Teniasolium. So ada even kita, let's say kita tak makan pork kan, because we are Muslim, tak makan pork. Tapi kalau that ada certain farmers, they using human feces kan as a baja. So the risk of getting the infection is there. So kalau you not properly wash the vegetables, and then that farmers using human feces, and that human feces contain eggs of the Teniasolium. So although you're not eating pork, then you can still get the Teniasolium and cysticercosis lah kalau makan eggs kan. Okay, so immediate treatment of the infected patients and improvement of personal hygiene may prevent auto-infections. So kalau poor hygiene tadi yang auto-infections, kalau tak properly wash hands, and then boleh jadi auto-infections. Okay.